Welcome to Legacius Pharma, a place that brings hope to cancer patients.
Let's dive into LegaNilo, a new cancer medication that doctors are starting to trust more and more in their fight against the disease. LegaNilo, containing the active ingredient nilotinib at a strength of 200 mg, is a second-generation tyrosine kinase inhibitor. It was developed to enhance treatment outcomes for patients with Philadelphia chromosome-positive chronic myeloid leukemia CML, while also addressing limitations seen in first-generation drugs like Imatinib. Compared to Imatinib, nilotinib has a higher binding affinity to BCR-ABL, resulting in stronger and faster inhibition, as well as a greater potential to achieve deep molecular responses. Let's talk about the indications of LegaNilo. LegaNilo is indicated for the following cases. First, newly diagnosed chronic myeloid leukemia CML, for adult patients in the chronic phase of Philadelphia chromosome-positive Ph CML. Second, patients who are resistant or intolerant to prior therapy, specifically, adult patients with chronic or accelerated phase Ph CML who are resistant or unable to tolerate previous treatments, including Imatinib. For these two groups of patients, LegaNilo plays an important role in an effective disease control strategy. By targeting BCR-ABL directly, it helps improve molecular response and offers better long-term outcomes for individuals living with CML. What is the mechanism of action of LegaNilo in treating CML? BCR-ABL protein targeting. Nilotinib targets BCR-ABL, an abnormal tyrosine kinase formed as a result of the Philadelphia chromosome translocation. It selectively binds to the ATP binding site on this protein, preventing ATP from accessing and activating BCR-ABL. By blocking this critical activation point, the oncogenic kinase activity is effectively shut down at its source. Inhibition of tyrosine kinase activity. Without activation, BCR-ABL cannot phosphorylate downstream substrates. This disrupts the signaling cascade responsible for the uncontrolled proliferation and survival of leukemic cells. By interrupting these pathways at the molecular level, nilotinib helps slow disease progression and improves long-term outcomes for patients. We hope this video has helped you gain a clearer understanding of nilotinib and its important role in the treatment of chronic myeloid leukemia CML. Please note, the use of nilotinib must be prescribed and closely monitored by a hematology specialist. Do not use this medication without proper medical consultation. For more detailed information about LegaNilo, please contact our professional support team through official channels. We are always here to support you.